implantation bleeding is always light. Because you're pregnant does not mean you will not see any bleeding. It is normal to see implantation bleeding, and this sometimes lasts throughout the first trimester. So you might be pregnant for months and you won't even know. Come on, sis. Woman that is having sex and you don't want to get pregnant, right now you might actually be pregnant, okay? Because you're seeing bleeding does not mean that you're not pregnant. You may be pregnant already. Every day or at the end of every woman's cycle, there are two categories of women. The first ones are the ones that are trying to get pregnant. This type of women, they monitors their cycle, they have sex at the right time, especially during their fertile window and their ovulation day. And the second category of women are the women that are avoiding pregnancy, yet they have sex, they don't use protection, and they don't use contraception. This type of women might be pregnant and they won't even know until it's late. Because they're bleeding every month, they are mistaking this blood for their period. Meanwhile, it is mostly not their period. It might be implantation bleeding. Hello everyone, you're welcome back to Dr. Shakeerah's channel. If this is the first time here, thank you so much for clicking on this video. And for the returning subscribers, thank you so much as well. Dr. Shakeerah is highly grateful. Today's video is going to be focusing on the difference between implantation bleeding and the normal menstrual bleeding, because women are mixing this thing up. Like I said earlier, that there are two types of women at the end of each cycle. The first ones are the ones that are trying to get pregnant. You see, this type of women, they have sex at the right time, they follow their fertile window, and they have sex this period. In fact, some of them even track their ovulation as well to make sure they have sex at the right time. But at the end of the cycle, like 14 days after their ovulation, they come to my DM and be like, Dr. Shakeerah, I had sex on this so date. I did this, I monitored my ovulation, and I have all the pregnancy symptoms, yet I am still seeing my period. And you'll be like, how can you be pregnant and still be seeing your period? One, it is impossible. What you're experiencing might be your implantation bleeding, but because it is difficult for most women to actually differentiate between implantation bleeding and menstrual bleeding, that is why majority of women are pregnant and they will not even know until a few months or when their stomach starts showing or when they start gaining weight. And that is when majority of them get to know that they're pregnant, because they're mixing the implantation bleeding with their normal menstrual bleeding. If you're currently seeing your period, whether you're trying to get pregnant or a woman that is avoiding pregnancy, this video is for you too, because you might be pregnant and you will not even know, and you will think you're menstruating. Meanwhile, it is not your menstruation. So what you need to do, for me, whether you're menstruating or your menstruation is coming, and as well, if you have menstruated but you still have an idea what your period looks like, please pay a very close attention to your period whenever it comes, or if you have an idea what it looks like before. There are 4 things I want you to pay close attention to. The first one is the consistency. Yeah, the consistency of the bleeding you're having. The second one is the color. The third one is the flow, while the third one is the duration or the length of that bleeding. All these are very important. Before I proceed in telling you the difference between implantation bleeding and the menstrual bleeding, I know you're familiar with the word menstruation already, so we won't be wasting so much time on that, but I'll be telling you about implantation. Implantation bleeding happens when fertilized egg travels from the fallopian tube into the uterus, okay? The egg gets released from the ovaries into the fallopian tube. It's going to stay for a while, and if the sperm comes and fertilizes this egg in the fallopian tube, it's going to take about 10 to 14 days. This egg is going to travel from this fallopian tube into the uterus, the womb, where it's going to stay to the end of 9 months. Okay, it is not going to develop in the fallopian tube because the fallopian tube is too small to accommodate the pregnancy, the fetus growing. So it is not designed for babies. So those are one of the ectopic pregnancy. That is not the topic for today, okay? So where the baby is supposed to stay to the end of 9 months is in your womb. So after the fertilization, the egg travels at least for about 10 to 14 days from the fallopian tube into the womb, into the uterus, where it grows bigger to the end of the 9 months. So during this implantation, when it's attaching itself to the wall of the uterus, you might notice bleeding this time, but the bleeding is usually light. That is what we call implantation bleeding. You don't have to be worried about this. It is totally normal. It is totally fine if you're having implantation bleeding. Although during the time the egg is traveling from the fallopian tube into the womb, there are lots of divisions taking place, which is not part of today's video, but I'm just telling you it takes about 10 to 14 days for this to travel from the fallopian tube to the uterus. Now, take a note, 10 to 14 days. And when it attaches itself to the wall of the womb or the uterus, you might notice bleeding. 1. Menstruation as well. If you're familiar with my videos, by now you will know that you get your period at least 14 days after your ovulation. 2 weeks after your ovulation, that is when you see your period every month. At least 14 days after your ovulation, you get your period. Now, if you have sex, okay, whether some days before your ovulation or on the day of ovulation, so far this egg gets fertilized, okay, on your ovulation day, and it takes about 10 to 14 days to travel from the fallopian tube to the uterus to attach itself, and you notice bleeding between 10 to 14 days. This can coincide with the time you are meant to get your period naturally. I said that your period is meant to come at least 2 weeks or 14 days after your ovulation. So if you have implantation bleeding to between 10 to 14 days after this egg is fertilized, definitely this can easily be missed with your period bleeding. That is why majority of these women are pregnant and they cannot tell because they're having bleeding on the same day of their period or the time their period is supposed to come. That is when they're experiencing implantation bleeding. You don't menstruate when you're pregnant. You can only have implantation bleeding. Although there are some other factors that can make a woman bleed even when she's pregnant and when she's not pregnant, aside from period, but it's not for today's topic. Today's topic is focusing only on implantation bleeding and menstrual bleeding. Okay, now we already explained how these implantation bleeding can coincide with your menstrual bleeding. How can you differentiate between implantation bleeding and your menstrual bleeding? I asked you to pay attention to the consistency because implantation bleeding, the consistency of this blood, of the bleeding is thin and is always watery. Is watery and is thin for implantation bleeding. Unlike period bleeding is always thick and sticky. It's always sticky and it's always thick. Yeah. The second one is the color. Implantation bleeding has something like pinkish color or brown or even dark red, like old blood. That is the color of the implantation bleeding. Unlike a period, period is usually starts with bright red. As the flows becomes heavier, it becomes darker, like becomes dark red. So it starts with bright red to dark red. That is for the period bleeding. The number 3 is the flow. During implantation bleeding, you may not even know you have implantation bleeding until you wipe. You may not be needing menstrual cups, tampons, or even menstrual pads. But doing menstrual bleeding, you need all these things and even more. That is the difference. You don't need tampons, menstrual pads during your implantation bleeding. And the last one, which is the fourth one, is the duration or the length. Implantation bleeding lasts for hours. It usually lasts for hours to 2 days, sometimes 3 days. It varies from woman to woman. So this is usually between hours to 3 days, 2 to 3 days. But menstrual bleeding, now you already know, you're used to these things already. Usually between 3 days to 7 days. If you bleed less than 3 days, you need to see your doctor. And if you bleed more than 7 days, you need to see your doctor as well. Because menstrual bleeding is usually between 3 to 7 days. But for your implantation bleeding, usually lasts from as to at least 1 to 2 days. Yes. Period bleeding is always heavy and possibly with clots. Okay, you might have blood clots in your period, but during implantation bleeding, it does not come with blood clots. So now I believe you can tell the difference between implantation bleeding and menstrual bleeding. For women who are trying to get pregnant and they monitor their cycle and they're actually sure they had sex at the right time during their ovulation time, if they notice any bleeding that happens to be on their menstrual date, on the day they're meant to see their menstruation, I think this might be implantation bleeding. Okay, I suggest to go see a doctor, get a pregnancy test done. If it's needed, go for ultrasound. But that decision will be after you have seen your doctor. So he's going to determine, he or she is going to determine what type of tests you need at that time. And for every woman that is having sex and they don't want to get pregnant, right now you might actually be pregnant. Okay, because you're seeing bleeding does not mean that you're not pregnant. You may be pregnant already. So now, pay a very close attention to your period when next you bleed. Implantation bleeding is always light. Because you're pregnant does not mean you will not see any bleeding. It is normal to see implantation bleeding, and this sometimes lasts throughout the first trimester. So you might be pregnant for months and you won't even know. Come on, sis. In my next video, by God's grace, I'll be telling you possibly reasons why you might be pregnant and still getting negative pregnancy tests. Some people do urine test and it comes out negative. Meanwhile, they are pregnant. I'll be telling you possibly causes of these things. Please watch this video over and over again to get this message. Share with your friends, families, and even sisters, colleagues. Like and drop your comment. Please, again, like and subscribe to my channel, because liking, sharing, and subscribing helps channels to grow, and it encourages someone to do more content like this. So if you're enjoying this video, please subscribe to my channel and like this video, and please help me share as well. Thank you so much for watching this till the very end. I will see you guys in the next one. Thank you.